So we're here today to talk to you about mental health. Mental health is a major issue. 16.6% of Americans suffer from major depressive disorder, and 30 million Americans suffer from eating disorders. However, only 50% or half of these people will receive any sort of treatment. We think that one reason that so many people are not receiving treatment that they need is that treatment is often very expensive and also very time-consuming. So one solution that we thought of is that exercise, which is usually free and also not as time-consuming as other interventions, could actually be a way to help out with mental health disorders. For eating disorders, first, exercise is usually thought of as harmful because it's excessive and compulsive, and the person usually doesn't have control over how much they're exercising. However, there have been studies that have looked at limited amounts of exercise in populations of people with eating disorders, and they've shown that there might be promising results for different exercise types at limited amounts.
Additionally, there's been lots of really great studies looking at the effects of different types of exercise on depression. Some studies have actually shown that endurance or cardio exercise can be as effective as common antidepressants in treating depression. There are other studies showing that strength training exercise might also have these same benefits, but these studies are far fewer and their methodology is not as good. And there have been very, very few studies comparing endurance and strength training exercise. So our study wants to fill this gap in the literature by examining further these different types of exercise and how these might be associated with different mental health benefits or issues. So what we did was we surveyed 303 Duke PE students and asked them about their volume of exercise, what types of exercise they had been engaging in throughout the semester, and then also surveyed them for different depression symptoms and eating disorder symptoms. So what we found was, while there seems to be a trend for the more exercise you do, endurance or strength, or even both types of exercise, we didn't find any significant differences between each different group as far as affecting depression, or any association between depression. So this implies that maybe endurance and strength training exercise are having the same impact on depression, but future research needs to study this further.
For eating disorders, we found that we first did a correlation analysis to look at the relationships between endurance exercise and disordered eating symptoms versus days of strength training versus disordered eating symptoms. The one on the left is minutes of endurance exercise per week versus the amount of disordered eating symptoms. And as you can see, there is a little bit of a positive correlation between them, implying that as the minutes of endurance per week goes up, the amount of disordered eating symptoms may also be going up. But that same relationship was not found for strength training. So this implies that endurance exercise may be harmful for eating disorders, or at least more harmful than strength training, whereas strength training may be something that could be put into different eating disorder treatments in the future.
So our study is purely an association study. We just looked at correlations and predictors of these different effects, but follow-up studies are really important, looking at causality and randomized control trials to determine if these different types of exercise are actually causing these benefits or issues we're seeing in mental health or not. But our research is definitely really important. Mental health is still a really big issue, and we really need to keep searching to find these alternative treatments. So we want to thank our team for all their help and support, especially our team leaders, Dr. Zucker and Director McNally, and that is our presentation.